I want to thank everyone for coming to this amazing webinar conversation about advocacy and how individuals and organizations really make a big difference when it comes to talking to the members of Congress, and why it's so important and getting members to co-sponsor bills or to submit requests for appropriations or things like that, because most members of Congress and their staff won't know that they have constituents that want this unless constituents reach out and ask for it directly. So we are really excited to be here today with two amazing panelists, Brandy Lee Sawyer, the Advocacy Director for the Shepherd Foundation, and Felicia Woods, the Executive Director of the Cancer Support Community. So with that, I'm going to throw it over to Brandy Lee and Felicia to do a quick introduction of themselves and why they are so passionate about cancer advocacy.
Thanks, John. Yeah, and we're so glad you guys are all here. I am the mother of three boys, Gavin, Everett, and Finn, and my youngest son, Finn, battled a very aggressive and rare cancer called rhabdomyosarcoma. He was diagnosed in 2016, and he battled for 2.5 years, and he went through relapse after relapse and major surgeries and a ton of chemo, a ton of radiation. His second surgery was so invasive in order to get clear margins that he actually was unable to walk. And I share all of that because the cancer community knows how awful cancer treatment is. And I just wanted to let you know that I'm with you, and I see that, and I have lived it and experienced it, and I know that it's hell on earth. And also tragically, and very devastatingly, Finn died after his third relapse, which was December 3 years ago. And I always say, like, I gained my advocacy voice when Finn died. And it was kind of during his treatment, but it really was after he died, because I did not want what he went through to be lost or in vain. And I wanted his perseverance and the journey that he went on to be heard and to be known, and to allow everybody to learn from the harsh reality that he went through, and the places where we can improve in cancer treatment. And I try not to be incredibly negative, because it's very easy to be that way when you're a bereaved parent. I'm trying to see it in a light where we can make a difference. And that's kind of where I resolved after Finn died, was to make a difference. So that's kind of my story in a nutshell with regards to becoming an advocate. And I should have maybe let you go first, Felicia, but I turn it over to you. And I'm actually really honored and really glad to be a panelist with her, because she is incredible.
Well, that was a kind entry to talking about me. But thank you, Brandy Lee, for talking about your story. You know, cancer advocacy is all about personal stories, and it's all about, you know, making the connection of a personal story to advocacy and creating policy. I'm Felicia Woods, as has been previously mentioned, the Executive Director of the Cancer Policy Institute at Cancer Support Community. And just a little bit about our organization. CSC is guided by our mission to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. We are focused on psychosocial well-being of patients and look beyond just the physical symptoms to what affects patients, caregivers, and their loved ones. So looking at mentally, emotionally, financially, and so forth. We're the largest professionally led nonprofit with 50 affiliate partners in over 175 locations throughout the country. Specifically, we provide and deliver a comprehensive menu of personalized and essential services at no charge to anyone diagnosed with any cancer and to his or her loved ones. As mentioned, I lead the Cancer Policy Institute at CSC, which proudly and boldly uses our 3 pillars: patient services, insight, and advocacy to serve our community through engagement and public policy and advocacy at both the federal and state levels. And so we've become a leader in advancing the evidence base and promoting patient-centered public policies to ensure that the patient voice is at the center of the national dialogue. And just like Brandy Lee, I have my own, personal stories of why, cancer advocacy is so important to me, just having family members who have battled with cancer and some who have survived and others who have unfortunately succumbed. I know the importance of a collective voice, and that is how you really elevate and lift public policy to ensure that the people that policymakers are trying to better serve are actually better served. So I'm grateful for the opportunity to be here, and let's get started with the program.
Yeah, can you, real quick, do you think you can tell us a little bit about your background on Capitol Hill and some of that work that you did? Because you're definitely an expert when it comes to this advocacy and why it's so important.
Sure, happy to. I started off working on Capitol Hill in around 2008. I worked for a member, Russ Carnahan from Missouri, and I handled his healthcare portfolio. One thing I would say about working on the Hill, you can be handed any issue at any time and you have to be ready to go. And I was very appreciative to be handled the healthcare portfolio during a time where President Obama was coming into office, being elected into office, and his main focus was on creating more accessible and affordable healthcare. So I started off working on the Affordable Care Act, which really helped to educate me on some of the importance of why we needed better access to treatment. And it led me down a path of advocacy. I think my advocacy work started to be elevated and cultivated by working on the Hill, because you got to hear from different patient groups, people coming in talking about what was important and what needed to be included in the legislation. And oftentimes my member, he would say, okay, well, we need to work on this part of the legislation, Medicare Part D or Medicare Part B, to make sure that patients have an increase of access, have an increase of innovation, and an increase of therapies and treatments. And so I hit the ground running, making sure that whatever was coming down the pike as far as the Affordable Care Act, it was actually something that people could see the benefit of and reap the benefit of, and make sure that those treatments and therapies were available to folks who, work in different localities or in different states. I always use my grandmother as an example. If something would benefit her, then I know I'm doing some good work. And I remember talking to her about the Affordable Care Act and saying, well, this would be helpful for you when it comes to your Medicare Part D. And it'll be helpful when you go to the doctor, you'll be able to get more access to treatments. And she's like, well, then you need to work harder and work smarter to get this through. And I was like, okay, well, I can't bend the arms of the legislators, but that advocacy work helped me out with patient groups, reaching out to our member and their personal stories, just how they talked about their day-to-day of not being able to afford treatment. And we would sit and go through the policies and say, okay, well, this would be helpful for this population, but what can we do for the collective? And that's why the Affordable Care Act was such a high success and continues to be a great success. So working in Congress, working in the House, but also working on the Senate side, I had an opportunity to work for Senator McCaskill on a lot of her work when it came to older adults and ensuring that they didn't have to do that delicate dance of paying for prescription drugs, in addition to making sure that they were able to pay for groceries or, pay their rent. We really have to think about what policies are doing and how they affect people as at the pharmacy counter or even at the grocery store, and not ensuring that people don't have to go through that equation in their head. Well, if I spend $50 here, then I won't take my medicine. And I was grateful to work for a member who really understood that struggle and ingrained in me the importance of advocacy. And that's one of the reasons why I went to working in cancer advocacy, because I believe that the collective voice really moves the needle.
I thank you for sharing that. I also worked on the Hill, and I used my grandma as a very big example during the Affordable Care Act debate. So especially when it came to being denied coverage and for diabetes. So I'm glad I'm not the only one who uses my grandma as an example when it comes to advocacy. Brandy Lee, I would love to hear why. Can you talk about why we are here today, and why advocacy is so important? I know when we started working together, it was not something that you were really familiar with or that you did a lot of, but you really grew amazingly when you were talking to members of Congress and their staff. And I think the conversations we've had previously, you've been really able to explain how you've gotten to understand why advocacy on Capitol Hill is so important. So can you talk a little bit about why we're here today and why advocacy is, why we're here and why what we're doing?
Yeah, absolutely. I know for me personally, advocacy wasn't anything I thought about. And I've shared this story mostly with my closer circle. I maybe have shared it on one of these calls, but I used to hate politics, and I kind of roped all politics into one lump thing that I was learning in high school. And it was overwhelming, and it seemed like it was too convoluted for me to understand or ever want to get involved in, because I didn't think that I would ever make a difference with any matters that I cared about, or that the majority of people cared about. So I used to say, I hate politics, and I stayed very far away from it. Embarrassingly, I would not do my research when it came time for elections. And I think it's important to point that out, because there are a lot of people like that. There's a lot of people like me who feel like we feel like maybe we're not smart enough to understand it. We feel like our vote's not going to matter. We feel like the actual thing that we care about, like cancer treatment and making a difference in that world, that we can't do anything about that. And it couldn't be farther from the truth, because every single person makes a difference. Whether you're calling and writing a letter, whether you're going to Capitol Hill, you're sending an email from your email, it's all of the one person, the individual people who are all collectively joining together to let their voices be heard. And so if you are not contributing your voice to that, then that's one less person that Capitol Hill is not hearing from. So when it came time to make a difference, because of Finn's death and where I saw the gaps in the system, one of the gaps that I saw was molecular diagnostics at the time of diagnosis. And I actually didn't talk about how I came to work at Shepherd, but through a friend of a friend, I got connected to David Heisung, who is the CEO and founder of Shepherd. And I actually reached out to them for treatment options for Finn. And they were a very new biotech at the time, when Finn was still alive. And so they didn't have anything for his particular cancer at the time, but we stayed in contact. And in just a mother's plea to David, kind of days before Finn died, I told David, I'm not a scientist, I'm just a mom, but I need to make a difference, because this cannot keep happening. And I know that so many parents and so many family members and loved ones are in the same boat. We get to this point where our loved one dies, or they're left with these debilitating health effects after their cancer treatment. They may survive, but they also are left with these debilitating effects of cancer treatment, because cancer treatment is so harsh and so barbaric. And we have to do better, and they want to do better, but they're also at a loss. And so when I started working for Shepherd and going to Capitol Hill with you guys, and seeing how therapeutic it was for me to share Finn's story, and and that it just felt good to let his legacy live on, and to know that I was making a difference, to sit in the offices of these legislators, whether it be a congressman or senator or even their staff. Like, their staff is not to be minimized. Those guys and those ladies and gentlemen are some of the hardest workers you'll ever meet. And they were taking notes. They were in tears. They became passionate about what we were asking them to, what we were advocating for with regards to our bill and the molecular diagnostics. And it was so enlightening and just so therapeutic for me. And so I want the cancer community to know that and to feel that too. And I want us to make a difference. And the only way we're going to do that is if we all join together and all let our voices be heard, for all of the legislation and matters that need to be addressed, and to make cancer universally survivable.
Thank you so much, Brandy Lee. I know she talked about particularly molecular diagnostics, and I do want to pull up a bill that Shepard has worked on with Congress, and it was a long time of advocating for the bill, making changes so it would be introduced in a bipartisan manner, and it would get as much support as we can. So I'm just going to put this bill up there. I'm using it as an example of how what bills, what are in bills, and how we can advocate for bills. And I know there are a ton other cancer legislation out there. I know Felicia has been spearheaded a lot of those and got things past the finish line. So I'm going to have her talk a little bit about those experiences in a minute, but I just wanted to put up some slides on the Cancer Patient Equity Act, which was recently introduced. So let me just share my screen real quick here. Can you guys see that? Awesome. So HR 5377, the Cancer Patient Equity Act, was recently introduced in a bipartisan manner in the House by Congressman Butterfield, a Democrat from North Carolina, and a Republican, Gus Bilirakis, a Republican from Florida. And there are two major provisions of this bill, and Brandy Lee talked a little bit about molecular diagnostics when we were first talking. So right now there are about 380 forms of cancer. There are about 400 forms of cancer. 380 of those are rare. That makes about 95% of all cancers. And a lot of these, about 80% of these cancers, lack an FDA targeted therapy for their cancer. And a lot of times that is because we just don't have the research on that particular type of cancer. We don't have the cell lines. We don't have the diagnostics for that particular type of cancer. Molecular diagnostics are also really important in guiding a lot of times the treatment option, and we're able to get more precision medicine or understand better like what the drivers are, what will work, what won't work when we do these molecular diagnostics. Currently, not many private insurance will cover these, and CMS, Medicare, Medicaid, CHIP will only cover it for a number of cancers at first diagnosis, but they will cover them for all at second diagnosis. But at that time, the patient has already gone through chemotherapy or radiation, which could change the molecular makeup of that tumor or of that cell. So we won't have the initial drivers or things like that. So what HR 5377 does is would require Medicare, Medicaid, and CHIP would mandate coverage for these molecular diagnostics at first diagnosis. So this would allow a critical component providing accurate diagnosis, enabling next generation targeted therapies. And it's also able to really, especially important because cancers without a modern standard of care or where clinical trials or therapies may provide more hope, they just don't have those. So those molecular diagnostics are really important. And this would allow Medicare, Medicaid, and CHIP to cover them. And a lot of times private insurances will then cover these diagnostics once Medicare, Medicaid, and CHIP cover these. So it is really important that anyone who's diagnosed with cancer, right when they're diagnosed, they get these diagnostics or they're able to be offered these diagnostics at a reimbursable rate. And then the second part of the bill is an education and awareness campaign. Right now, a lot of physicians, patients don't really know about genetic testing or these molecular diagnostics. So the bill will create an education and awareness campaign through Department of Health and Human Services for physicians and the general public on what genomic testing is, how it's used, and the role of genetic counselors. It will also encourage adding this to curriculum of continuing medical education. Because these tests are fairly new and fairly modern, a lot of the older physicians or physicians that might not be working at an oncology center often don't know the importance of this. And a lot do, but some don't. So we want to make sure that these tests are being widely understood in both the medical advocacy and the medical education communities. So with that, I'm going to stop sharing my screen so we can go back to full screen here. And I would love to hear from Felicia to talk a little bit about some of the legislation that she has spearheaded and moved through the process, and give some examples of how advocacy really worked to put these bills to the forefront and get a lot of co-sponsors, get committee hearings, and get through the process. So Felicia, can you talk maybe a little bit about some of the legislation you've worked on and how you worked it through the process?
Sure, happy to. I, firmly believe in connecting people to policy. And, the real world issues that many people manage on a day-to-day must be accounted for when we're shaping policy. And that's big P or little p, that's organizational policy or even at the top level, federal policy. So the human element of a data point or statistic must be a constant variable. And I mean that, a person is behind each data point, and a person who has a unique story or has led a life prior to being diagnosed with cancer or any other chronic illness or syndrome. And, as Brandy Lee shared, being able to go and talk to staffers and talk to members of Congress and really use her personal story about her son, Finn, and educating members of Congress really helps to shape discussion. In the times that I worked on Capitol Hill, I think that I advocated harder for legislation when I had that personal story that I could connect that policy to, where I could take that legislative item and talk to my my boss about and say, okay, well, here's what's up for debate today, and here's the story of a young woman and her family, and this is why it would mean so much if you supported it, became a co-sponsor, or even help to talk to a member on the floor about this legislation so we can move it through committee and into final passage. Like, those stories really go with the legislation, because we know the process on Capitol Hill is, you introduce a bill, it goes through the committee process, and then it goes through floor and sometimes debate. But if you can have that personal story travel with that bill as it's going through the processes too, then that really elevates the message, in my opinion. And, if far often that patient voice is left out of the decision making because people feel like, I can't do advocacy. Advocacy isn't for me, or politics isn't for me. And it's not really politics. It's really telling what's true to your core, what's your personal experience, and why it's important that this piece of legislation becomes law, because it will impact my day-to-day. It will impact, my grandmother, as John and I share, and so one legislative item that I really enjoyed working on was at my, about a year ago, working on the Henrietta Lacks Enhancing Cancer Research Act. And right now we're really looking at health equity. We're really examining diversity. One of the biggest things that we can do is increase diversity in clinical trials and making sure that we're not just looking at homogeneous populations, but really expanding beyond looking at race, ethnicity, also socioeconomic status, and even older adults. There are a lot of older adults who are underrepresented in clinical trials, and many who have been diagnosed with cancer. So we need to really elevate how we're focusing on clinical trials and increasing diversity. And so this legislation was really a way for us to look at, what's going on in the federal government. How are federal agencies increasing diversity when they are putting together cancer clinical trials? Are they going beyond the usual group of people who participate in trials? Is there diversity included? Are there standards set to increase diversity? So the bill, which actually became law late around this time last year, really asked for the Government Accountability Office, which is the congressional watchdog. I'm sure John knows about the GAO. The GAO evaluates all government processes and looks and focuses on what can the government be doing better in a certain space. And so this legislation has the GAO to look at all of the federal agencies, so NIH, the National Cancer Institute, National Health Institute, and any other DoD, any other government agencies that are putting on clinical trials, to look at what they're using and the criteria to elevate diversifying clinical trials. And it's a way for them to report back to Congress on what the federal government should be doing. And if the federal government sets the standard to increase diversity in clinical trials, then oftentimes private entities follow suit. And so this legislation was near and dear to me because we started off with just a little bit of support. We eventually received bipartisan support on the legislation, and then it was introduced in both the House and the Senate and moved through the committee process, but got some snags along the way. And I think that's with any legislation, but also having community support. Many people know the story of Mrs. Henrietta Lacks and how a lot of her cells have been used for cancer treatments, for polio treatments, for a lot of treatments throughout the years, but not to her knowledge and not to her family's knowledge for a long time. And so being able to tell her story and the reason why, and connecting that to the reason why we needed diversity in clinical trials, was really a passion for me. And I think we were able to get the legislator to move forward because we want to do better in the equity space. We want to do better in giving people the rightful way of praising them for the contributions that they have made to science. So that legislative item became law, and I think this will set the stage of how we look at diversifying clinical trials. But because of her patient story and because of other stories and how we were able to change the dialogue on diversifying clinical trials, this will set the stage for more work in the clinical trial space. And as the government moves forward in increasing this, I think private companies are also taking the reins and moving forward and listening to what we need to be doing to make sure that the innovations that are coming down the pike really work for everybody. And we can't do that if we have homogeneous samples of the population.
Thank you so much. Yeah, and I think when I worked on the Hill, one of the first things that both bosses, and I think this is probably standard for most offices, is who in our district or who in our state asked for this. On the Hill, we get these, they're called Dear Colleagues. They're a letter that one member will send to another, and staffers will usually read these. And they might read through the letter and through the fact sheet and say, oh, this looks really great. I'm going to bring it to my boss to see if they want to co-sponsor. And the first thing that I knew I was going to be asked was who in our state or who in our district asked for this. And if I'm able to go and say, we got 100 letters or we got 30 letters on this, and we've got 25 phone calls on it. And here's just one example of a letter we got. My boss would be like, oh, our district, there are people in our district that care about this. Yeah, let's co-sponsor it. But if I went to them and say, hey, can you co-sponsor this bill? I might be able to be able to persuade them, but they really want to know that people in the district or people in the state have reached out, have expressed support for it. So it is really important that you go and do this. And I think the other thing, and Felicia talked about this a little bit, is that a lot of times these staffers are dealing with 100 issues at once, and they might read that letter and be like, okay, I get it, what it's trying to do, but I don't understand how it will impact my constituents or my boss's constituents. And by you telling the story, whether in a phone call or in an email, of, oh, now I know exactly how this would impact patients or people in my district, they were able to put that into their memo to the boss, or to have an example during staff time, or go to the floor when they're voting on the bill and say, I'm supporting this bill because here's a story from my constituent and this is why I'm really supporting it. Those are all things that members of Congress need when they're justifying why they are supporting a piece of legislation. And Brandy Lee, I think you've dealt with this in your own advocacy when going to members and talking to staff. So do you want to maybe just tell a little bit about your experience there?
Yeah, well, I was going to share a story, although I can't remember if it was a congressman or senator. Maybe you or Liz will remember, but it was pre-COVID when we were able to go and have a ton of meetings on the Hill. And we sat in a congressman or senator's office, and I was shaking in my boots a little bit because I really wanted to ask this question, but I did not. I was hoping it would be well received. And I said, why is pediatric cancer or rare cancers not a national health crisis? And he said, because we just don't know enough about it. And it's not that they're ignorant, that they know absolutely nothing, but it takes their constituents and advocates coming to them and saying, this is a huge problem and we need you to address it for us. We need you to enact some policy to correct this. And that's exactly
Brandy Lee.
Yeah,
just add that was Senator Durbin.
It was a senator. Okay.
He was to spend like 5 minutes with us, and he spent like half an hour, like way more. And he's extremely senior. And he also said, there's lots of health crisis. There's lots of health issues. He kind of like very empathetically, which got back to that point of like why we have to, as advocates, get loud, get in front of them repeatedly. And so I'm really glad that you shared that story, because I think that illuminates a lot.
Yeah, well, because I mean, we kind of, I guess people look at policymakers in all different lights and all different regards, but they're working for us, for their people, and we hire them, we vote them in. And so we need to tell them exactly what we care about and what needs to be addressed. And so that's, again, and going back to like how I was in high school, like I hate politics, blah, blah, blah. And then now it was like, I get it. This is my duty. This is my job. Like I have lived this. I have experienced this. I know what needs to be fixed, and I'm going to come and tell you about it so we can make the change.
And I want to just sort of go into a little bit of background of that story, because I think it shows the progress that we were able to make from our first point of advocacy to that. I don't want to even say end, because we're still going, but to that point of Brandy Lee's story is Senator Durbin at the time was I think at the time ranking member. I don't know. I don't think that he was in of the defense subcommittee on appropriations. And there's this thing called the CDMRP, which really focuses on funding research that affects diseases or illnesses that are directly associated with combat or service of members of the military. And this was even before my time at G2G. But Liz and the team here and the team at Shepherd were able to go to Senator Durbin's staff and say, listen, this is a huge problem. Here are all the cancers that disproportionately affect members of our military and their families because of their service. And with that, Senator Durbin's team was able to say, oh my God, this is a big problem, get it added to the list of the big pot of illnesses, rare cancers, a big pot of the illnesses that are able to get funded. And then because they realized it was because of the advocacy of Shepherd and a lot of the other cancer groups out there, they were able to get their own line of money now in the CDMRP that is specifically for all these 380 rare cancers that, or the large part of them that directly or impact our members of the military. And because of that, and because of all of that work with their staff, that we were then meeting with Senator Durbin, who's number 3 in the Senate on the Democratic side, in his office on Capitol Hill for a half hour, because it all started with the advocacy of these rare cancer groups. So they really do matter, and it is really how members of Congress get to know about things that they're passionate about. And unless you tell them, or it's in the news every single day, them and their staff are just not going to know about it. So. I would love to, I know there's a bunch of people here on the panel. There's also a bunch of people in the chat. I want to open it up to some questions or comments. If you have some great advocacy stories that you've dealt with, or if you have any questions about advocacy, I'm going to show you a toolkit that will really help guide you through this advocacy. I'm going to show that after this sort of little break in questions here. But yeah, please either unmute or ask questions in the chat, either about advocacy or any questions that you have.
And John, Myriad, I think I'm saying your name right, Myriad, which
Marie. Yeah. Marie, yes. Like parade. Sorry.
Oh, Marie. Oh, that's beautiful. So she had asked a question, and I can let you ask it if you wanted to. That way we can, I think I know the answer, but I wanted Liz, John, and Felicia to answer better.
My question really was, I feel that pediatric cancer is underfunded because, and maybe this is naive of me, they don't vote. So they don't have a voice. And I see, just from working with Smashing Walnuts as well, the funding is like 4%. Why is that? You know, of the federal funding with NIH. They make up 20% of the population in America. Why are we only funding them 4%? And I actually speak, my daughter passed away last year from DIPG, which is a glioma in the brainstem. And just to be aware that, like in America, a developed country, that's the case. I'm shocked.
I know. I'm sorry.
I'm very sorry for your loss. I think, Felicia, do you want to maybe talk a little bit about that? In my mind, in my view, I don't think members of Congress are looking at, oh, these are kids, they can't vote, so it's not a priority for us. I think it's the case of making sure people understand it and having family and friends reach out on their behalf to say, this is something that my family really cares about. And as a constituent, no matter if I'm a voter or not, these are things that I really care about. And Felicia, maybe you can talk a little bit about your experiences especially when it comes to pediatric cancers.
Yes, I 100% agree with you, John. I do not think that it has anything to do with, children not being able to vote. I really think it's, really looking at who's their voice, who's coming to Capitol Hill, who's making the connection and educating the staffers, educating the lawmakers about the need. I would say, I was actually trying to think of an example, and I do have an example. I just can't remember off the top of my head the name of the legislation. But when I was working for Representative Carnahan, we had a father from Texas who came every legislative session about a specific bill related to pediatric cancer. And apologies for not knowing, this was back in 2008, and my memory has failed me in getting that. But he came and knocked on everybody's door and really talked about, only 100,000 children face this disease every year. But because my son passed away from it, I want to make sure that nobody else has to deal with the trauma that I had to deal with. And so him coming and talking to me about his story 3, 4, 5, 6 times, I was like, all right, this is something that my boss needs to pay attention to. He wasn't part of our district by any means. Texas and Missouri far apart, but because I heard from him and he would follow up with all the information that I needed to make the case to my boss, we ended up actually getting this legislative item into the Affordable Care Act. And it passed on the House side. Unfortunately, it was stripped out on the Senate side and did not become law. But just know, from that man beating down doors and talking to us constantly about the importance, he made an impact in states that he had zero connection to. So I think it goes back to how you can be that voice and how you can get others to come along with you. And by educating, you can make tremendous change. It takes one who can bring another along, and then two, and by the end of it, you'll have 1,000. And that will really resonate with people. And through that, you can hopefully we can increase the funding that's dedicated to pediatrics.
Mm-hmm.
And I think, and we'll show this a little bit more when I screen share the toolkit, but I think you don't have to, especially now with social media, you don't have to be that, if you don't have, a lot of people don't have time to beat down the door 5 or 6 times to member of Congress, but you can post a toolkit. And this advocacy organizations, whether it be through Shepherd or through any other advocacy, many of these groups have these easy ways to contact your members of Congress that you can post on your Instagram, on your Facebook. You can talk to your friends at work or talk to your friends at Thanksgiving dinner and say, hey, just get on your phone right now, send a quick letter to your member of Congress to let them know why this is important. And those are easy ways to be able to beat down the door. You might not have the time to do that all the time, but you might have the time, just post a link every week and say, hey, please, can you please do this? And I think that's just easy ways to get a lot of support going. Letters to the editor, even in papers. Brandy Lee, I know you wanted to chime in there too. Sorry about that.
Oh, no, it's okay. I was just going to add a comment or my thought on pediatric cancers only getting 4%. And I think, John, you may remember before September, I was like, can you help me figure out if it truly is 4% of federal funding only 4% of federal funding goes to pediatric cancer specifically. And it is such a convoluted and complex thing to figure out that we were not able to figure out, even with John's Hill expertise and all the resources that he has access to, we were not able to really figure out if it's truly 4%. But I think it really is an issue of numbers. It's an issue of numbers of the number of patients with each diagnosis. So even though pediatrics are 20% of the population, pediatric cancers are a very small number of all of the cancer diagnoses in general. And so some people don't like the word common and rare, but you have your common cancers like your breast and your lung. And then you have rare cancers like ultra rare, like DIPG and like Finn's cancer, rhabdomyosarcoma. And really it's a matter of how many patients are diagnosed with those diseases. And I hate to say it, this is my own personal take on it. It's almost like a demand for the funding. And so the way that maybe the federal government does the funding is that they look at, there are 500,000 people with lung cancer diagnosed a year. I actually don't know if that's the right statistic, so please don't quote me. But I'm just using a large number in comparison to, about 450 for rhabdomyosarcoma a year. And so it's almost like a supply and demand type of thing. And so really what I know that we focus on at Shepherd is finding the commonalities and being able to treat based on commonalities, not by the cancer name. And hopefully we can actually get to a point in the nearish future where we are able to address more of the patient population, not just based on what the name of the cancer is, but based on those commonalities. Does that help?
I agree with you to a point, but I also want to kind of I guess just kind of go back with it a little bit.
Oh, absolutely. Because this is a conversation. This is not.
No. I feel also though, 4%, and I know you're saying that it's lesser people, there's not as much demand. But I also think those children don't get to live. So they've lost 70 years of their life, say, you know what I mean? So yeah, when you get older, you're going to have like different cancers. So there's a greater population. You've lost a great many children in America to cancer. They say 1 in 285 children will be diagnosed before the age of 20 with cancer. If you don't fund that, all of these children are going to, then 20% of that total is going to die. So they've lost 70 years. So I really feel like funding has to be directed more towards pediatric cancer. Why is it that you've got so much funding for the likes of breast cancer? It's because those women go out there and have lunches. People are afraid to go to a luncheon for pediatric cancer and bring it to the fore. Nobody wants to hear that a child could die. I can't get groups together to say, come to the Hill, march to the Hill, let's get votes, because guess what? Your child too could die. It's not rare when it happens to you.
And I think, especially when it comes to pediatric cancer, I think what needs to happen is that you come together as a group, as we are advocating for pediatric cancer. I think a lot of times groups come to Capitol Hill advocating for a specific disease or a specific cancer, which is commendable. But a lot of members of Congress and their staff will say, we are not scientists. We are not researchers. We cannot direct pots of money for a specific disease or a specific cancer, because that's just, we don't have that capability. So we're going to leave it up to the researchers. But I think when you have groups of people coming together and saying, we need more funding for pediatric cancer as a whole, or even brain cancer as a whole, that's what's going to say, okay, well, we can direct money to pediatric cancer, because we're not saying exactly what type, we're going to let that up to the researchers, but we're going to do that. And I think a lot of times, especially when I was on the Hill, we'd have people come in and they would talk about a very specific rare disease. And I would just have to say, I can definitely pass that along. I'll be on the lookout for it. But I wasn't a researcher. I didn't know where we were in the process. So I think being able to come together as a whole and say, okay, we need more money for pediatrics will be a little bit more well received than coming to the Hill asking for one specific line of funding.
Yeah, I agree. I think you do have to come as a collective, and I understand what the panelists mentioned about getting people together to do a luncheon related to pediatric cancer, and unfortunately, hearing that a child could die. But you really have to look at it like the cancer support community. We are a pan-tumor organization. So that means we don't select, we're not a breast cancer organization or prostate cancer. We advocate on behalf of all cancers, so even pediatric. So when we come to the table, it's really to talk about the collective and how we need more research when it comes to cancer. And thinking about the federal funding, so the appropriation season, a lot of times there are so many requests and so many letters that come to members of Congress for sign on to this legislation, sign on to this letter to support an increase in funding for this specific breast cancer initiative or this specific pediatric cancer initiative. We have to be mindful that the money that goes to NIH and NCI is within different pots. So if we're asking legislators to sign on to letters, be specific and advocate for for pediatric cancer, and ask them to sign on to that overall letter and not just on one specific type of pediatric cancer, because that way the staffers will know, okay, my boss needs to be mindful that as we move towards the appropriation season, the funding cycle, he needs to advocate for, I don't know, 25% of federal funding within NIH going to pediatric cancer, not just maybe 10% going to this specific line item or specific type of pediatric cancer. It's a method to it. And once you get into the nitty-gritty of policy, you'll really get a full understanding of how to advocate beyond just looking at legislation, but looking at the funding cycles and all types of ways to get the message across.
Great, thank you.
And Katrina, I see your question on the template. What I'm going to do, because we only have about 6 minutes left, I want to make sure, and we're cognizant of time here, I'm going to answer your question as I show the next screen in our template here, because it goes hand in hand with that question. So let me just share my screen, and hopefully, can you guys see this, the Shepherd Action Center?
Can you make it your full screen, John?
Yeah.
Because we can see the background. There you go. Perfect.
There we go. So real quick, this is just this Cancer Patient Equity Act of 2021. This is just more about the bill. So if you want to learn, just read a little bit more or have a little bit more under of the context of how large of the bill is, you can click here and it gives you the two major provisions, which I went over on our last spreadsheet. But the thing I really want to talk is this demand to be heard tab and how you can contact your reps and your senators. So unfortunately, so basically what I'll do is I'm going to put my old address in, so it'll bring up everyone here, because I currently live in Washington, D.C. and I don't have senators, so it won't bring them up. And I don't know why it's not working at the moment. Oh, here we go. So basically it'll bring you to this page and you'll type in your first name, your last name, your email address. Like I said, I'm going to change this to my parents' house in Pennsylvania. So you just type in all of your information here and you hit take action. So what it'll do is there's a call tab, an email tab, and a Twitter tab. So if you want to call your reps, it gives you their phone numbers up here, and it gives you a little bit of a script on how you can call and talk to their staff and ask them to support this. I encourage you to do this in the email too, and we can talk about that. But I always encourage you to tell a little bit of a personal story. It really makes that person that's answering the phone understand why this is so passionate for you. And Felicia, maybe you can talk a little bit about how important these phone calls are when you're working for a member of Congress and their staff.
Yeah, sure. These phone calls are all collected and sent in to the legislative assistants who really focus on how they can get the boss to sign on to the legislation. And being able to tell your personal story over the phone really connects the dot, and making sure that as we go and advocate on your behalf to the member of Congress, we're talking about the connection, your connection to the state also, but your connection to the issue and why it would be important for the member to pass this information along as they begin to think about how they want to vote on a particular piece of legislation, but also if they want to co-sponsor or be an original co-sponsor for a bill. It really helps with raising awareness. And as Liz said earlier about getting loud, this is definitely a way to do that, calling with your personal story.
And I'm just typing my email. So if people have any direct questions, they can definitely email me. But now I'm going to go to the email, which is part of, I think, Katrina's question. So this will allow you to send an email directly to all three of these members of Congress, your two senators and your representative. And you asked about sending sort of a sample email or just a sign-on email or adding your personal story. A lot of times what these systems are is how they collect their email. So if you just send, first of all, they all count. Whether you send just a form letter email or you personalize it, members of Congress and their staff will see this, they will respond to you, and they will keep account of all of these things. So no matter what you do, if you just hit send here and you delete that personal story, they will get it, and it will work. It will be noticed. What I like to do is add your personal story, because not only does it do exactly what we were talking about, is having that personalized, okay, this is exactly why my constituent supports this, but it also kind of separates it from the group. So if it is just one letter with no changes, a lot of times it'll come into their inbox as 30 people wrote in about this topic, where if you change a sentence and add your own personal story, it'll come in as one. So it'll come in as from John Richter and then from Brandy Lee, because you're getting different stories. So even if you add your own stuff in, it'll separate out. But like I said, if you don't have time, if you don't feel like you want to write out your personal story, it might be very personal and you just don't want to do that. When you're doing this, just delete that, add personal story, and sign your name here, and then just send it off, and you'll be able to get that. You'll be able to get that done. Does anyone have any, or does Brandy Lee or Felicia want to sort of talk a little bit about the email there?
Sure, I'm happy to say, when it comes to, I started off working on Capitol Hill as a legislative correspondent. So I responded to all of these emails that John is talking about. And if a person took the time to really write a personal story about how a legislation really affected them, sometimes the responses back, if it's just a formal letter, we send a form letter back. But if you took the time to write out a personal story, I made sure in my response to respond to that personal story. And even other times, if the story was so compelling, I sent it off to my boss, and my boss would read it and write a written response himself about that legislation to you, responding to your story. So that's the way of giving the attention of a member, by really honing in and writing down why this legislation is so important. I guarantee you'll make some inroads in that office, because it's showing that you care about this issue so deeply that you took the time to write, and oftentimes those members take the time to write back.
And then just over here, if you use social media, if you use Twitter, this will allow you to tweet directly at these members. And a lot of times people, your friends will see it, they'll send their own tweets, they'll retweet it. So this, and now when I was on the Hill, social media wasn't as big of a thing, but I know people that still work there. I know social media directors on Capitol Hill. These are things that they're looking out for every day. So it really does matter a lot when it comes to that. So this is the toolkit. I know, Brandy Lee, you put it into the chat. I know I put my email there, but I'm going to stop sharing my screen now and just see, does anyone have any particular questions about advocacy, about the toolkit here, about how your outreach will really make a difference on any bill or any piece of legislation that you really support? We're happy to answer that in the last few minutes. Katrina, did that answer your question? I want to make sure that I answer that for you.
Yes, it did. Thank you so much. I was hoping that you got to that. I figured it was coming, but I wanted to just make sure, just in case it wasn't.
Yeah, and it's a great question, because some people think that those form letters don't work. They do. When I worked in the Senate, especially, I'm from Pennsylvania. I worked for a Pennsylvania member. It's a big Commonwealth. Like, I would get some letters that I would come in one morning and there'd be 300 emails on one particular topic. And I would go to my boss, I would go to the legislative director, and sometimes I would even go right to the senator and say, in the last week, we got 2,000 emails on this particular bill. I then immediately went and read it. And you don't need to do 2,000. I might just say there's 30 this week. That might be a bill that I really want to look at to see if my boss should co-sponsor. So while we're doing the outreach through Capitol Hill, talking with members directly, trying to get their staff to join, they really need this outreach for either phone call, email, whatever you have the time for to really do that. So I would encourage you to put it on your own social media, send it to your friends. If these are bills that you really care about, get on there and send those letters, make those phone calls, because it really will make a difference no matter what bill you're looking at. I can't guarantee your member will definitely support it, but it really does make a difference and really can show, okay, I think I really want our members to be able to do that. So with that, I will throw it over to Felicia, Brandy Lee, or even Liz to see if they have any wrap up points that they want to make.
I'd love to just to say thank you. Thank you all for dialing in. Thank you for sharing your stories, your ideas. This is just the beginning. We're going to keep doing these on a regular basis, connecting with you and making sure our voices are heard, that you're supported. We appreciate all that you're going through, all that you're juggling, and that you took time out to join us today. This is amazing, amazing journey that I've been on. I've been privileged to be on with Brandy Lee for many years now, with David Haisong. So just thank you, thank you, thank you. And I'll stop talking.
I can't thank everybody enough for being here. And like Liz, you had put in the chat box, like this is only the beginning. And I'm a people person. I love talking to people, getting together with people. So I put my email in there, and it's also out on the World Wide Web, so you can contact me. I know that all of you feel the same way as far as people contacting you. So it really is all about community. And I think, especially in the cancer community, knowing that you're not alone and that we can do this together is really important. So definitely contact me, contact us, and we'll keep getting loud together and making change.
Well, I'll just say thank you for the opportunity, Liz, John, and Brandy Lee. It's a pleasure to share the virtual stage with you. And this was extremely informative. And, I'm looking forward to further conversations. If we can get more people into advocacy, we can definitely create some phenomenal changes. So thank you.
Thanks, everyone. Like I said, don't hesitate to reach out to any of us. I think our emails were all in the chat. So yeah, don't hesitate to reach out if you have any questions or you need help in any way. We're happy to do it. Thanks, everyone. Have a good day.
Bye.